On this episode of the Dairyland Initiative podcast, we're going to be talking about corkscrew claw syndrome. Hi, I'm Courtney Hallbach.
And I'm Nigel Cook.
And this is the Dairyland Initiative podcast,
where we get to discuss issues related to the housing and management of dairy cattle.
Let's dive in. Well, I said enough of stalls for a bit. I was getting a little bored with that.
You were bored.
And then all of a sudden, I've had a few emails the past week or two about heifer housing. So I thought, let's switch gears a little bit and maybe focus on another area that the Dairyland Initiative is known for besides housing, and that's lameness.
A little bit of lameness. Yeah.
But then Dr. Cook said, that might not be appealing to all of our listeners. But I think it's an important topic because it relates to animal welfare.
It does. And this one is a sort of fairly new condition that people may not be aware of, that they may be experiencing for the first time.
Yeah, so as the industry is now starting to build more housing for heifers, we want to talk about this emerging lameness issues specifically related to heifers, and so that's what our episode is going to be focused on today.
And so we've got a subtitle of a new twist on an old lesion. So let's start with the old lesion.
Yeah, what is that?
We've long recognized what we call traditional corkscrew claw. Older cows, probably related to poor hoof care, housed animals, but not frequently trimming, so the hoofs get overgrown. Generally, rear feet, outer claw, so the outer claw of the rear feet, and the medial claws of the front feet.
Okay.
So that's what we would, again, refer to as traditional corkscrew claw, often believed to be genetic in origin. I honestly don't believe that to be totally true, because we don't really see it anymore. And the reason we don't see it anymore is because
of improved housing?
Better housing and better hoof care. We've got great hoof trimmers doing a really good job trimming feet. When you do that, you don't tend to see it.
So this problem also occurred in older animals, whereas this new problem...
That's the emphasis. So that's not what we're talking about.
Okay.
What we're talking about is something similar, but almost completely different.
Because you're seeing it in different locations. So how did this come to be?
Well, good question. We'll try to investigate that a little bit more, some of the survey work we've done. But we're talking here about what hoof trimmers have referred to for quite a while as reverse corkscrew, which is a bit confusing because, does that mean it corkscrews the opposite way? Or what they really mean is it's not the outer claw of the rear foot, but it's the inner claw.
Okay.
So it's the medial inner claw. So on a foot like this is the medial or inner claw, and that's the one that's corkscrewed.
And this is on the front feet?
It can be on the front and the back, but the classic is that it involving all of the legs. So it's observed on the back feet. You may get a little bit of corkscrewing on the front feet, often believed to be sort of pushing against the feed bunk and rotating of the claw. But this syndrome, because it's kind of a combination of signs, the important point is that you see corkscrewing of the medial claws of the rear feet.
Okay, got it.
And it's younger animals. This is occurring in growing heifers.
Okay, and was this just something somebody called out of the blue one day and said, "Hey, Dr. Cook, I noticed this weird reverse corkscrew"?
Kind of crept up on us. I think hoof trimmers were seeing it in growing heifer populations. They would record it in their hoof trimming records. We'd look at it and go, yeah, something's going on, but it's kind of a minor nuisance. We didn't recognize it as a significant lameness problem, but it kind of got worse over time. So as the years passed, herds got bigger, more reliance on, as we'll see, freestall housing for heifers. It became a problem, and the severity can increase to the point where 70+% of heifers can have this. And a good proportion really can barely walk when they calve.
So are these animals able to stay in the herd, or are these...
No, and that's the interesting point. It's occurring in herds that have got lameness under control. So the herds that are managing digital dermatitis, have good cow comfort, so we're not seeing a lot of sole ulcers, good flooring, got white line disease under control. Bam, you've got a new lesion. We're dealing with this one. In
your replacements.
And it's not necessarily a lameness problem because the heifers really don't stay in the herd. When they're severely affected, and I will show you some pictures, it's pretty gruesome and they really can't get to the milking parlour and back effectively. So it appears as an early lactation young animal culling problem.
Okay.
That's the issue that really alerts us to the severity of the condition in a given herd and having to do something about it.
Okay.
So that's the topic for today.
I like it.
So here's a sort of classic heifer, older heifer, but you can see that corkscrewing on the medial claw of the front feet, but importantly, both back feet, you can see some corkscrewing of the medial claw of the rear feet as well. So that's a syndrome is a combination of signs. Mm-hmm. So that's why we're kind of using that terminology. What you'll also see is this very characteristic wide-legged walk in fresh heifers.
Yeah.
And you can see she's really got quite a bit of discomfort and really splayed her back legs there. It's because she's really walking on one claw per foot. So that medial claw
is what's bearing all the
kind
weight.
Of overgrown. Mm-hmm. It's now bearing all the weight. The outer claw in many cases, isn't even bearing weight anymore. And you'll see this is a severe case here where you can see complete twisting and corkscrewing of that claw. So you end up with, poor little heifers, fresh calved, walking on one claw on each foot, particularly the back feet, and they really struggle to get around.
Yeah, that looks painful.
And to the point where if you only have one claw and you're in a big herd and you're walking to and from the parlour on concrete, you end up then getting thin soles. So it wears the thickness of the sole away. We can, in some cases, have exposure of the corium in the toe, so what we call a toe lesion or a toe ulcer. And then you've got complete undermining of the entire sole, and you have to trim that all the way back.
Ugh.
So I have to point out that Courtney gets a little squeamish with some of these pictures.
Yeah, I can handle a little bit, but all this blood, there's a reason I didn't become a vet.
Those of a squeamish tendency may do better just listening on
this episode.
On the Apple podcast or Spotify rather than seeing the gruesome pictures. Ugh. If you like a little drama in your life and a bit of gruesome, then join us on YouTube for the full effect. So it's very easy to go to a herd and this be a thin sole problem. And we see that in a lot of our bigger herds where cows are walking long distances. We'll have thin sole issues, particularly when we're using recycled sand, which is abrasive and causes horn removal, and will return to bedding types as an important factor in this condition.
Okay.
So I said it's a syndrome. So sometimes the corkscrewing isn't what the producers notice.
They're seeing something else.
They see something else. Sometimes,
transfer?
and you'll see it in this one, the front feet have really short claws. So the claw here is really worn and short, to a point where you kind of wonder, where's the pedal bone gone? So that heifer has very characterized, very upright front claws and very, very short. Another one is this kind of splayed digits.
Yeah.
So
what's this sign again?
The old Vulcan thing.
Oh, yeah.
Live long and prosper. Star Trek fans. I'm with you. The weight of the front of the animal is such that in some of these heifers you get this really splaying of the claws.
Okay.
On the front feet. It's noticeable. You kind of look and you go, that looks weird. So a syndrome of signs, different signs in different situations. We've had the good fortune to work with hoof trimmers that have been recognizing this condition for a while now, and amongst them would be Carl Berge, and this is a slide from him. So Carl's collected feet from heifers that have been culled in early lactation that have suffered this corkscrew condition, and he has a garden full of beetles, and he puts the feet in the beetle bin, and
Carl, I hope this is
they expose
place
the
of work
bone.
and
They get
not
rid of
your
all
house.
they get rid of all the soft tissues, and you're left with the bones. But what you'll notice about these bones are that they're very abnormal. Notice that, Courtney?
Kind of, if I wanted to look closely. But
How's
again,
the stomach?
Yeah.
We've got a relatively normal side, so the other side is relatively normal. There aren't any sort of bony, what we call exostoses, fancy term
That's a
for
fancy vet
lumpy
term?
bits of bone.
Okay.
They're caused by inflammation. Yeah, so if you have inflammation of the bone, it reacts, it grows in odd different ways, and you get these lumps on the bottom of the flexor tuberosity by the connection of the common extensor tendon. And also we've got abnormal bone not only in the pedal bone, which is the last bone of the skeleton of the leg, but in the next bone up, what we call P2, the second phalangeal bone. So that's also changing. So that's telling us there's inflammation involved.
Okay.
Okay. And that doesn't go away, by the way. So you're dealing with a heifer. This is a freshly calved first lactation heifer, and her bones have been permanently changed.
Yeah. So it's a lifelong problem.
And here's another one even uglier. So this is the corkscrew claw, and all this bony proliferation is abnormal, caused by inflammation. So I would think that would be painful.
I would imagine so. If it's anything like my Achilles.
Yeah, you've got a bit of Achilles going on.
Yeah.
I've got a bit of plantar fasciitis. God, I'm getting old. It hurts.
Yeah.
So if you're a heifer and this is going on in your foot, how do you get the pressure off the medial claw? You cross your legs. So
When
again,
I first saw these photos, I thought it was some like dance move, but that's not how heifers
that's not
move.
what heifers usually do. It's
No.
not a cartoon,
No.
Courtney.
You're right.
So what they do is they try to put the weight on the outer claw, the non-inflamed claw, by crossing their legs. And so again, it's a syndrome. You may only notice this if you're not looking at the feet very carefully. You'll suddenly see your heifers doing this weird cross-legged dance. Okay, it's a pain response.
Okay.
So they're trying to get the weight off the medial claw.
And there's a couple of things environmentally related or housing related that are contributing to this, correct?
We believe so. I think talking to hoof trimmers that were dealing with this condition, they would say we're seeing it predominantly in sand-bedded barns.
But you're the sandman.
I am a big proponent of sand. Yes.
But maybe not so much in heifers.
We might have to reconsider. They associated it with pushing against the feed bunk on abrasive floors, with feed bunks that were fitted with headlocks. All things that we kind of recommend for adult cows.
Yeah.
Adult cows do very well in pens with sand-bedded stalls and headlocks at the feed bunk, grooved floors. So why were these risk factors for this condition in heifers?
I hope you went out and tried to solve it. Get an answer.
Good news is we did.
Oh.
So Carl Carlin, and here we've got Adam Strebe, shout out to those two students, joined me for, I think, in their third year.
I would say a fun summer of visiting.
Oh, a fun summer of
farms.
visiting heifer barns. Roger Olson from Zimpro helped us identify farms with and without this condition. So we tried to stratify the group of herds that we went to kind of explore, okay, what's going on. And the easiest way we found of evaluating the heifers was when they were at the headlocks. So they're all lined up, and you get a nice powerful flashlight, what the
Beam.
British call
Boom,
a torch.
Oh, yeah, the Brits call it torch. So
It's a
whenever
torch.
Dr. Cook goes, hey, can you grab the torch? What?
My students, when I used to do that, my students would look at me and kind of start looking around for a sort of burning
Yeah.
Olympic kind of
That's what a torch is.
flashlight.
Oh, thank you.
Okay, so we've got those nice LED flashlights now. Just shoot that straight down vertically above the claw, and you're looking for deviation of the dorsal hoof wall right at the coronary band. And if you shine a flashlight on it, you can kind of see the crease. You can see the inside, the axial wall of the claw. So that's what makes it easy.
Okay.
So we have a kind of scoring system, mild, moderate, severe. We kind of lumped everything into one for the purpose of the survey, and ultimately because we found it to be quite common. So when we went to 43 herds, we found overall about 16% of heifers had some degree of this corkscrewing of the rear feet.
That doesn't sound good.
And
Uh-oh.
We found it in the older cows as well. So again, this is a permanent change occurring in the heifer population that lives with that animal throughout the rest of her life.
Is there any way to help them with trimming?
There's some adaptations to trimming, and that's what good hoof trimmers do. They'll keep these animals in the herd.
Okay.
And what they do is kind of do the reverse of what we do with trimming. We deal with the outer claw as an inner claw, and an inner claw as an outer claw. So you kind of just reverse how you trim these animals.
Got it.
But you have to be exceptionally careful that you don't over trim them. That would be key. So some herds, and we're looking at the heifers here, had none, and some herds over 70%. So kind of scary at those, and as you get more, the severity increases.
Mm-hmm.
So the severity was very much in line with prevalent. We looked at 3 populations of heifers: breeding age, pregnant age, and pre-fresh. You could kind of see that the prevalence of corkscrewing increased, and you'd somewhat expect that for something that was environmental in origin. That was kind of the greater the time of exposure, the more that you see. And this was a problem of freestalls. So the bedded pack barns we went to had a little bit, but very low levels. So this is a freestall problem, and that would be disingenuous to just leave it there, because it really is a sand-bedded freestall problem.
Okay.
We're not seeing this issue in freestall barns with mattresses. So that was kind of crushing.
Yeah, I would say so.
For someone who really likes sand bedding. But as you can kind of see here, it's a particular problem in the herds using recycled sand.
Mm.
So we've got many sand-bedded barns with heifers in them. There are many that we don't see this condition, but we do see it very commonly in those that are using coarse recycled sand.
And is it something to do with the sand being on the grooves and then the animals being at the feed bunk?
I think seeing this kind of data, you have to associate it with the abrasiveness of that material, which gets us back to the thinning of the sole and the impact it's having on hoof growth and wear. Why is it such a problem now? That I think there were lots of things going on at the same time here. Because up until the 90s, we really didn't see it.
Mm-hmm.
So what are the things that have happened? Well, we've got better fertility programs, and up until the last few years,
lots of heifers.
We were making too many heifers, and we didn't go around building a lot of new barns.
Oh no, just fit in the existing facilities.
So there was a little bit of overstocking going on, and then there was this notion that we could limit feed them. Which probably works in non-overstocked situations, but when you've got a limit-fed situation where you've got a lot of heifers competing at the feed bunk, you can imagine there's lots of scrabbling and an interaction between the heifers and pushing at the feed bunk.
Yeah.
So we saw that. We saw changes to hoof trimming practices. Hoof trimming, particularly hoof trimming that removes the axial wall, can kind of exacerbate this, not only in heifers but older cows as well. And I don't like to say accelerated growth, because I think we've kind of realized that we were not growing heifers as fast as normal.
Yeah.
But we've definitely accelerated their growth to sort of normal rates, but in housed barns, in a situation where predominantly they're standing on concrete, not on pasture. And the geneticists always want to they always want to get involved in this.
We got to give them credit too.
Yeah, no, this is not a genetic problem, I don't think. We'll talk about some of the issues that could be genetics in our next episode on heifer housing, but I don't think corkscrew claw is related to genetics at all.
Mic drop.
Lots of geneticists getting angry now.
Yeah.
Okay. What do you do? The recommendations when you have a problem herd. You've usually got deep-bedded sand.
Yeah. Can we switch that out?
I'm not going to switch it to mattresses.
Oh, let's
we're still
do some manure solids.
Yeah, we're going to keep the deep bed and use manure solids. You're dealing with a heifer. You're dealing with low risk for udder infection in this population. So the biggest disadvantage of manure solids for our lactating cows is mastitis. We're not seeing that in the heifer population. Put rubber flooring in front of the feed bunk.
On all types of flooring, or is this on excessive grooved floors?
All new heifer barns should have rubber in front of the feed bunks. And I don't recommend rubber in front of the feed bunk for older cows.
Oh, you do not.
So this is different. And then we feed to greater refusal. If we're using little push-up robots, they have to be calibrated to heifers, to less feed, so that we're pushing that feed up closer to the manger. And I have used in-feed supplements, postbiotics, that are anti-inflammatory to help deal with the inflammation occurring in the foot, to try to lessen the severity of the problem. So that's my sort of go-to 4-point intervention.
I've got a lot of questions now about how we can do this in our heifer facilities, and I have a feeling you're going to cover a lot of the answers to my questions in the next episode.
In the next episode, there's going to be a cliffhanger here, folks. You'll have to join us for the next one. That's when we start talking about new facilities.
Ooh.
For sure. Yeah, I just want to wrap up with a recent case study experience, which kind of encapsulates what we've been experiencing with this problem. So, beautiful heifer barn.
Oh, it's gorgeous.
It's really nice.
Wide open sidewalls, bright, beautiful sand bedding, great looking animals.
Yeah.
But
yeah, but built in the spring of 2023. By the fall, things were unraveling.
Yeah.
So, late August, they started to see lame heifers. So this did present as a lameness problem because of the severity of the issue.
In a very well-managed herd.
And a really well-managed herd that we've worked with for years. High production, really low levels of lameness in the rest of the population. So this is pretty typical of what we see in this situation. So this comes as a surprise to the farmers because they're good managers. They've got lameness under control. They do what they think is the right thing, what we thought was the right thing.
And they build a heifer barn very similar to their adult cow facilities that are doing really well.
Just mirroring what's working with our adult cow population, and we've got problems. So I visited this farm in November 2023. Can't believe it was that long ago.
Yeah.
And they had all the signs. This is, again, corkscrew claw
Crisscross
syndrome.
Legs, you had the splaying of the...
Very short front digits. See how short that one is, Courtney? You don't appreciate how tiny that is.
No, I try to look up.
But yeah, corkscrewing on the front, corkscrewing on the back. Yeah, so this is the full syndrome, everything that we see all in one place. And if we look at the risk factors, we've got sand bedding, we've got free stalls, we've got headlocks, we've got a concrete flooring surface. And the farmer had issues with this little robot pusher. These are built for mostly adult cow barns where we've got bigger piles of feed. And there's little magnets embedded in the manger here, and that's what the robot kind of
follows,
calibrates to, and it follows. And they had to sort of recalibrate it relative to the distance from the bunk to get that feed pushed up.
Yeah, so that animals didn't have to reach
that's what he noticed, that the animals were reaching for the feed too much, and that could well have exacerbated the severity of this particular outbreak. We went in and we did all those 4 intervention points. So we switched from sand bedding to manure solids. Fortunately, there was a supply of manure solids available from a local digester. The farmer paid and put rubber flooring in front of the feed bunk. Made adjustments to the pusher, and we did use that in feed anti-inflammatory. So this was the situation in November of 2023. As you look at the 4 main groups of heifers in this barn: growing age, breeding age, pregnant, and pre-fresh, and they've all got it. Mm-hmm. The worst affected was actually the pregnant age, up at almost all of them.
Yeah.
So 84% of the animals in the pregnant pen were affected, and some pretty severely in the pre-fresh pen. Pretty bad news, and really worried for the long-term future of those heifers, because I know what's going on inside the feed when I go to these farms, that these are permanent changes that are occurring. But the good news is, after about a year, we've eliminated the problem.
Excellent.
And we followed this through to May of 2024, where we've basically almost eliminated the problem in the younger heifers at that point, the growing and breeding age. We've still got it lingering in the oldest heifers because they were already affected back in November the previous year. So again, we're still seeing 80% of the pre-fresh heifers impacted.
Mm-hmm.
But fast forward to January of this year, we're not seeing it now in any of the growing, breeding, and pregnant age heifers, and just a few mildly affected pre-fresh heifers.
That's fantastic.
So it's a really kind of good story for the farm. Breathe a sigh of relief. We've kind of averted disaster, but it also really highlights that I think we know what's going on here.
Mm-hmm.
That this is a growth wear issue of the hoof, and if we can reduce the wear, reduce the thin soles, reduce the inflammation, we can eliminate the condition.
That's excellent. I like leaving on a positive note.
Let's do that. So to summarize, we know what causes this, and it ain't genetics, because the genetics of the animals on that farm didn't change over the course of the year. Not related to hoof health, that's for sure. So this corkscrew claw syndrome, these lesions develop during heifer rearing.
Mm-hmm.
Okay, we'll occasionally see a weird outbreak in older cows where the heifers are okay, and it's usually hoof trimming related. It's usually related to excessive trimming in the axial wall, very overstocked pens, pushing at the feed bunk, as we've seen. But it's usually heifers, so always look at the heifer population. We didn't record it in growing age heifers in our survey because it was just too difficult to do, but you will see it in that age. But the key is the breeding age.
Okay.
The breeding age heifers are really key. And when we've put our models together to try and explain the prevalence of this condition, it's sand bedding, especially recycled sand bedding, in the breeding age heifers. That's the key. So we're going to revisit our recommendations for heifer housing, and it's going to really impact what we do before those animals become pregnant.
Okay.
That's a key age group. And so the hypothesis is that the abrasiveness of the bedding, sand and especially recycled sand, thins the sole, causes inflammation of the structures within the claw, the pedal bone, creates permanent change, and then the forces that are placed on that animal, feeding at the bunk, rough concrete, being able to put their weight against a headlock, changes the skeleton and rotates the claw because of that inflammation. And there's adaptations to how those animals move, as we've seen with the splaying of the front digits, the cross-legged, they're adapting to the pain associated with that inflammation. While we don't know everything, we know enough to fix it. So we're going forward with new recommendations. And the realization is what works for adult cows isn't necessarily the best for heifers.
Well, I'm looking forward to hearing more about what works for heifers based on the survey that you and the students did several summers ago. So please join us for our next episode that's going to be talking about heifer housing.
Stay tuned, folks.
The Dairyland Initiative is supported by industry leaders who are advancing cow comfort worldwide. We would like to say a special thank you to our premier sponsor, Saputo, who is providing the global community with high-quality dairy products made from high-quality milk from healthy and well-cared-for animals. We'd also like to say thank you to our other sponsors, SaveCows.com, Zinpro, GPS Dairy Consulting, 40 Barn, Sure Gain Trow Nutrition, Munters, J&D Manufacturing, VES Artex, Ventec, and Kestrel Instruments. Thanks for tuning in to the Dairyland Initiative podcast. Want more Dairyland Initiative? Be sure to subscribe to our podcast, follow us on our socials, and visit our website for all of the latest recommendations in dairy cattle housing and management. See you next time.